There's a truth you admit: erectile dysfunction doesn't always start with illness. Often, it begins with a brief moment of anxiety. One failed night can turn into a heavy memory, haunting a man, draining his confidence, and creating a vicious cycle that is hard to break. The more he fears it, the harder it is to control, until stress itself becomes the biggest barrier to intimacy and mental well-being. The good news is that this condition can be improved when we understand its true causes and choose healthy, science-based ways to restore confidence. Part 1. Erectile dysfunction medications and their hidden risks. Modern medicine has given men a quick solution to one of the most sensitive issues they face: erectile dysfunction. A small pill promises to restore confidence and intimacy, making it seem like an easy fix. Yet behind this convenience lies a critical health risk, especially for men already dealing with cardiovascular disease. Erectile dysfunction drugs work by relaxing blood vessels and improving blood flow to the penis. At the same time, many heart medications such as nitrates or antihypertensives also affect vascular tone. When combined, the result can be a dangerous drop in blood pressure, leading to dizziness, fainting, or even life-threatening cardiac events. This is why doctors consistently warn that ED treatment should never be separated from a thorough evaluation of cardiovascular health. Unfortunately, men often fall into two extremes. Some undergo excessive testing, full executive health checkups that screen for every possible risk factor, often leading to unnecessary costs and stress. Others bypass medical care entirely, obtaining ED medications online with a few clicks, never discussing their heart health with a doctor. Both approaches are problematic. Overscreening wastes resources and heightens anxiety, while underscreening exposes men to preventable dangers. The most effective path lies in balance. Before prescribing ED medication, a physician should review blood pressure, cholesterol, blood sugar, and cardiac history. With this context, ED treatment can be both safe and effective. Rather than seeing the pill as an isolated solution, men should view it as part of a larger health strategy, one that protects the heart as much as it restores intimacy. Used wisely, ED medications can be allies, not threats. Part 2. Testosterone, metabolic health, and the power of lifestyle. Testosterone is often described as the fuel of masculinity. It drives muscle strength, energy levels, mood, and sexual vitality. Yet its decline is not just a matter of age, it is also tightly linked to modern health conditions like obesity, type 2 diabetes, high cholesterol, and hypertension. The relationship is a vicious cycle. Excess body fat produces inflammatory compounds that disrupt hormone production, lowering testosterone levels. In turn, low testosterone makes it harder to maintain lean muscle, accelerates fat gain particularly around the abdomen, and worsens metabolic disease. As one condition fuels the other, men find themselves stuck in a downward spiral. In search of quick fixes, many turn to dietary supplements advertised as testosterone boosters. But scientific evidence for most of these products is weak or non-existent. Some herbs, such as Tongkat Ali, show minor effects in small studies, yet results are inconsistent and nowhere near the impact of healthy lifestyle changes. Research is clear: exercise is the most reliable way to optimize testosterone. High-intensity interval training, HIIT, and resistance training that engages large muscle groups, squats, deadlifts, bench presses, stimulate natural testosterone production. Combined with quality sleep, a balanced diet, and stress management, these habits support hormone health without the risks or false promises of unproven supplements. In reality, testosterone levels are not controlled by a single pill or powder. They reflect how we live every day, how much we move, what we eat, and how well we rest. Choosing strength training over shortcuts is not only safer but also creates long-term resilience, benefiting both hormonal balance and overall vitality. Part 3. Testosterone Replacement Therapy, TRT. Benefits and hidden costs. When testosterone levels fall dangerously low, testosterone replacement therapy, TRT, can dramatically improve quality of life. Many patients describe it as transformative. Libido returns, energy surges, muscle mass stabilizes, and the fog of fatigue lifts. For men who have struggled with symptoms for years, TRT feels like a second chance. Yet no therapy is without cost. TRT is not simply a hormone boost, it fundamentally alters the body's internal balance. By supplying testosterone externally, the body reduces its own production. Over time, this can shrink the testes, decrease sperm count, and significantly increase the risk of infertility. For younger men hoping to have children, this consequence is particularly devastating. There are other medical concerns as well. TRT can raise red blood cell counts, thickening the blood and potentially increasing the risk of clotting. Ongoing monitoring of hematocrit and cardiovascular status is essential. This is why guidelines require that testosterone be measured on at least 2 separate occasions, alongside clear clinical symptoms, before therapy is considered. Equally important is recognizing what TRT cannot do. It is not a substitute for healthy living. Poor diet, lack of exercise, and chronic stress will blunt its effects while amplifying its risks. Men who view TRT as a shortcut are often disappointed. The therapy works best when combined with lifestyle changes that support heart health, muscle strength, and mental well-being. TRT is a powerful tool, but like any tool, it must be used responsibly. For the right patient, under medical supervision, it can restore vitality. For the wrong patient, or in careless hands, it can take away more than it gives. The wisest approach is caution, evidence-based medicine, and a commitment to long-term health, not short-term gains. Part 4. SHBG, free testosterone, and the prostate debate. As men age, changes in hormone biology become more nuanced than a simple low testosterone reading. One key factor is sex hormone binding globulin, or SHBG. This protein attaches to testosterone in the bloodstream, leaving only a fraction as free testosterone, the form the body can actually use. Even when total testosterone appears normal, high SHBG can reduce free testosterone enough to trigger symptoms such as fatigue, low libido, or difficulty maintaining muscle. This distinction matters in treatment. A man with normal lab values but high SHBG may still experience the effects of low testosterone. In such cases, doctors may consider carefully tailored interventions, though the decision requires nuance and specialist oversight. Misinterpreting lab work can lead either to overtreatment or to dismissing a patient's very real symptoms. Another major concern often raised about testosterone therapy is its impact on prostate health. For decades, men and even many physicians feared that supplementing testosterone would accelerate benign prostatic hyperplasia, BPH, the enlargement of the prostate gland that leads to urinary symptoms. Yet high-quality studies now suggest otherwise. Testosterone replacement does not appear to worsen urinary problems associated with BPH. This finding challenges long-standing beliefs and provides reassurance to patients and clinicians alike. Still, it does not mean TRT is risk-free. Prostate health must be monitored, and the decision to start therapy should weigh individual benefits against potential risks. The bigger lesson is that male hormone health is complex, requiring more than a single lab test or assumption. Age, SHBG, free testosterone, and prostate health all intersect, and only by viewing the full picture can men and their doctors make the best choices for long-term well-being. Part 5. TRT in older men and the myth of No Nut November. One of the more controversial questions in men's health is whether men over 65 with low testosterone on lab results, but no significant symptoms should be treated with TRT. Some argue that restoring testosterone could reduce risks linked to metabolic syndrome, such as diabetes or cardiovascular disease. Others caution that without symptoms, the benefits may not outweigh the risks, especially considering the need for lifelong monitoring and the potential complications of therapy. Ultimately, the debate highlights a broader principle. Medicine should treat patients, not numbers. If an older man feels healthy, energetic, and functional, low testosterone on paper may not justify intervention. Conversely, if symptoms are present and quality of life is affected, carefully managed TRT might be appropriate. Shared decision-making between patient and physician is essential, especially for older men with multiple health considerations. In this same age group, cultural myths often complicate the conversation. A notable example is No Nut November, a social media meme that gained traction as a supposed method to boost testosterone through semen retention. While catchy as a viral challenge, scientific evidence shows that abstaining from ejaculation does not meaningfully increase testosterone levels. Hormone health is shaped by lifestyle, diet, sleep, and stress, not by memes. This juxtaposition is telling. On one hand, serious medical debates about TRT in seniors, on the other, viral internet trends promising shortcuts. Both reflect how male health often swings between over-medicalization and oversimplification. The truth, as always, lies in careful balance, listening to science, not hype, and focusing on overall vitality rather than gimmicks. Part 6. When lifestyle wins over hormone therapy. Testosterone replacement therapy should never be prescribed to men with normal hormone levels. Yet in today's wellness culture, many are tempted by clinics or advertisements promising optimization even when no medical need exists. This is both risky and unnecessary. The foundation of male hormone health is not in a syringe or gel, it is in lifestyle. Sleep, for example, is one of the most powerful natural regulators of testosterone. Studies show that even a week of sleep restriction can dramatically reduce hormone levels, while quality rest restores them. Similarly, regular exercise, especially resistance training and high-intensity workouts, stimulates natural testosterone production and improves blood flow, directly enhancing sexual and overall health. Nutrition and cardiovascular care also play central roles. A diet rich in whole foods, lean proteins, and healthy fats supports hormonal balance, while avoiding smoking and excess alcohol protects the vascular system that erections depend on. By prioritizing heart health, men protect both their longevity and their sexual vitality. Choosing lifestyle over unnecessary TRT has another advantage: it empowers men with control, rather than relying on external hormones with lifelong risks. Lifestyle changes offer sustainable improvements with side benefits: better mood, sharper cognition, stronger immunity, and lower risk of chronic disease. This does not mean TRT is never appropriate. For men with clinically low testosterone and persistent symptoms, it can be life-changing. But for those with normal levels, the wiser path is to maximize natural capacity first. Every hour of sleep, every workout, and every healthy meal is a deposit into a hormonal bank account that pays dividends in energy, performance, and confidence. The message is simple yet powerful: before seeking hormones, reclaim the fundamentals. Often, the cure is not in a prescription pad, but in the daily choices that shape a man's health for decades to come. Part 7. Stop-start, edging, and the role of sleep erections. Premature ejaculation is one of the most common sexual concerns among men. While it often creates anxiety and tension in relationships, the good news is that it can be managed with simple behavioral techniques, sometimes even without medication. Two of the most effective methods are known as the stop-start technique and edging. The stop-start technique is straightforward. When a man feels close to climax, he pauses stimulation until the sensation subsides, then resumes. Over time, this builds awareness of physical signals and teaches control over the body's arousal curve. Similarly, edging involves intentionally prolonging arousal by slowing down or varying stimulation. Both methods help men gain confidence, extend the sexual experience, and reduce performance anxiety, the very anxiety that often makes the problem worse. Beyond techniques that require practice, nature itself provides men with a built-in protective mechanism: nocturnal erections, or sleep erections. These spontaneous erections occur several times a night during REM sleep. Their purpose is not sexual pleasure, but physiological maintenance. By delivering oxygen-rich blood to erectile tissue, they preserve elasticity and function, ensuring that the penis remains healthy even in periods of sexual inactivity. Understanding this natural process helps reframe how men view their sexual health. Erectile issues do not always mean permanent dysfunction. Sometimes they reflect stress, fatigue, or other temporary barriers. Knowing that the body itself performs nightly maintenance can bring reassurance. Together, these strategies, behavioral techniques like stop, start and edging, along with the body's natural sleep erections, form a powerful reminder. Sexual health is not only about medical treatments, it is also about awareness, patience, and trust in the body's ability to protect itself. Part 8. Aerobic exercise, weight loss, and the truth about size. Few topics generate as much insecurity for men as penis size. It is often exploited by marketing campaigns promising miracle pills, powders, or devices. Yet science is clear, no supplement has ever been proven to permanently enlarge the penis. These promises may sell, but they rarely deliver real, lasting results. What does work, however, is much simpler: lifestyle changes. One overlooked fact is that weight loss can make the penis appear longer. The erectile tissue itself does not grow, but reducing fat around the pubic area reveals more of the shaft that was hidden. This visible change can boost confidence without the need for untested products. Even more significant is the role of aerobic exercise. Research shows that men who commit to at least 150 minutes of aerobic activity per week reduce their risk of benign prostatic hyperplasia, BPH, a condition that enlarges the prostate and causes urinary problems. Exercise also improves cardiovascular function, lowers blood sugar, reduces cholesterol, and strengthens circulation, all essential for erectile health. In this sense, exercise offers a dual benefit. It improves how the body looks and how it functions. A healthier heart means stronger blood flow, which directly translates into better erections. Meanwhile, weight loss improves body image and reveals what was always there. The real takeaway is that men should focus less on shortcuts and more on sustainable practices. Aerobic activity and weight management are not only safe and evidence-based, they also enhance overall health. Instead of chasing a mythical size enhancer, men can invest in fitness and diet, achieving results that extend far beyond the bedroom. Part 9. Causes of ED and a range of modern treatments. Erectile dysfunction, ED, arises from different causes depending on age. In older men, vascular problems are the primary culprit. Hardened arteries, reduced circulation, and cardiovascular disease make it difficult to achieve or maintain an erection. In younger men, psychological factors are more common: performance anxiety, stress, or lingering trauma from past experiences. Despite the differences, one theme is consistent: the mind always plays a role. Treatment options are equally varied. One approach is daily low-dose tadalafil. Beyond improving erections, it restores confidence, breaking the cycle of fear and failure. For men who do not respond to pills, intracavernosal injections are available, boasting an effectiveness rate of up to 80%. Although the idea of injecting the penis may sound intimidating, under medical supervision, it is safe and highly effective. Surprisingly, exercise has also emerged as a therapeutic tool. Studies show that high-intensity interval training, HIIT, performed for just 7 minutes a day over 2 weeks can significantly improve premature ejaculation. The reason lies in the nervous system. HIIT helps balance sympathetic and parasympathetic activity, giving men better control over sexual responses. This diversity of treatments underscores an important truth: there is no one-size-fits-all cure for ED. Each man's experience is unique, shaped by physical, psychological, and lifestyle factors. The best outcomes come from combining medical guidance with personal effort, medication when necessary, therapy when appropriate, and lifestyle changes as a foundation. Most importantly, men should know they are not alone. Erectile dysfunction is not a sign of weakness. but a signal that something in the body or mind needs attention. With today's range of options, there is always a way forward. Part 10. Communication, pineapple myths, and prostate screening. In sexual health, communication is the cornerstone. Many couples struggle not because of physical limitations, but because they never openly discuss desires, preferences, or concerns. A relationship built on silence often leads to frustration, while honest conversations foster trust, intimacy, and mutual satisfaction. Asking and listening are just as vital as technique or stamina. One persistent myth in sexual culture is the idea that eating pineapple or drinking pineapple juice dramatically changes the flavor of semen. While sweet fruits may alter taste slightly, the bigger influences are hydration, overall diet, and lifestyle. A man who drinks plenty of water, consumes a balanced diet of vegetables and lean proteins, and avoids excessive smoking or alcohol is far more likely to notice a neutral or pleasant effect than someone relying on pineapple juice alone. In other words, real improvements come from consistent habits, not quick tricks. The same principle applies to prostate cancer screening. For years, the dominant message was test, test, test. But the reality is more complex. Prostate cancer often grows slowly, and not every case requires aggressive treatment. Automatic testing without context can lead to overdiagnosis, unnecessary biopsies, and even side effects from treatment that was never needed. The more balanced approach is shared decision-making, a thoughtful discussion between doctor and patient, weighing risks, benefits, and personal values before deciding on screening. At its core, male health is not about chasing myths or reacting to fear, but about informed choices. Whether it is communication in the bedroom, diet for overall wellness, or decisions about cancer screening, the best outcomes come when men replace shortcuts with dialogue, knowledge, and shared responsibility. Part 11. Female sexual health, citrate, and the role of diet. Conversations about sexual health often focus on men, yet women face their own challenges, particularly around sexual desire. Two medications, Adi, flibanserin, and Vyleesi, bremelanotide, have been developed to address female hypoactive sexual desire disorder. Unlike quick-acting solutions, these treatments work gradually. Women may not feel an immediate surge of desire, but over time, they report subtle shifts, greater responsiveness, more interest, and an improved sense of connection. These gradual changes can be life-changing, restoring confidence and intimacy in relationships. Beyond medication, diet and hydration remain central to overall well-being. One example is the role of citrate, found in certain flavored water mixes like Crystal Light. Citrate increases urinary citrate levels, which help prevent kidney stones by reducing crystal formation. Something as simple as daily hydration, supported by citrate-rich beverages, can protect kidney health and improve comfort. On the other side, excessive consumption of red meat has been linked to a higher risk of kidney stones and metabolic complications. For women and the men alike, balanced nutrition, plenty of vegetables, adequate fluids, and limited processed or heavy meats supports not just general health, but also sexual vitality. What emerges is a consistent theme: sexual health cannot be separated from overall health. Whether through medications that carefully adjust brain chemistry, or dietary choices that protect organs and circulation, the body thrives when we think holistically. Desire, energy, and well-being grow from the same soil, a lifestyle that values both balance and care. Part 12. Sex education, safety, and protecting the next generation. No matter how diligently parents monitor, children and teenagers will eventually encounter sexual content on phones, online, or from peers. Pretending otherwise only leaves them unprepared. That is why sex education is not a luxury, but a necessity. When young people are taught about their bodies, consent, safety, and respect, they gain the tools to navigate a confusing world with confidence rather than shame. One critical part of education is debunking unsafe practices. Some adolescents experiment with constriction devices or homemade cock rings in an attempt to prolong erections. These improvised bands, often made from metal objects, can trap blood in the penis for too long, leading to swelling, tissue damage, or medical emergencies. Without knowledge, curiosity can quickly turn dangerous. By teaching openly about risks and healthy alternatives, parents and educators can shift the narrative. Instead of fear-based silence, conversations should emphasize responsibility, communication, and respect. Sex is not something to fear or exploit, but a natural part of human life that requires maturity and care. At a broader level, making sex education evidence-based and accessible helps protect not just physical health, but also emotional well-being. It equips young people to make informed decisions, avoid harmful myths, and respect both themselves and their partners. In the end, the message to the next generation is clear: your body is valuable, your safety matters, and knowledge is your greatest protection. When society invests in education rather than secrecy, it raises not only healthier individuals but also healthier relationships for the future. Erectile dysfunction, testosterone, and men's health are not just medical issues, they're mirrors of how we live, how we care for our bodies, and how we handle stress. The truth is simple: there are no magic pills, no secret tricks. What truly restores strength is knowledge, discipline, and balance. When men choose better sleep, consistent training, honest communication, and informed medical guidance, they don't just fix symptoms, they reclaim confidence, intimacy, and vitality. In the end, the greatest power isn't in a prescription, it's in the choices you make, every single day. Thank you for listening until the very end. If today's story has gently stirred your heart, whether through an old memory, a present feeling, or something never spoken into words, please leave a like, subscribe to the channel, and turn on the notification bell. Intimate wisdom is where we come together to touch the hidden corners of love, affection, and sexuality, things that may seem private, yet are in fact the very core of happiness. I wish you to always love deeply, live truthfully, and find yourself in every glance, every touch, and every trembling heartbeat. Affectionate greetings.